Good morning, everyone. Welcome to today's presentation. I'm excited to be here with you. Today, we'll be exploring Ticagrelor. This is the first slide, which serves as our cover. We'll start by introducing the topic and giving you a quick overview of what's coming up. Over the next few minutes, we'll cover the key aspects of Ticagrelor, including its uses, benefits, and important considerations. So, let's get started. Today, we're going to go over the objectives for this session, starting with an overview of how antiplatelet drugs are classified. We'll explore their introduction, understanding their mechanisms of action, and how their pharmacokinetics influence their use. We'll also look at the various indications for these drugs, appropriate dosing strategies, and potential adverse effects. It's important to recognize contraindications to ensure safe use. And finally, we'll discuss drug interactions that can impact their effectiveness or safety. This comprehensive overview will help us appreciate how these medications play a crucial role in preventing and treating thrombotic conditions, tying everything back to the overall theme of managing cardiovascular risks effectively. Let's start with an overview of what Ticagrelor is. It's a medication primarily used to help prevent serious cardiovascular events like strokes and heart attacks, especially in people with acute coronary syndrome. This condition involves sudden reduced blood flow to the heart, so effective prevention is crucial. Ticagrelor works by inhibiting platelets, which are blood cells involved in clot formation. By doing this, it reduces the risk of clots that can block arteries and cause these dangerous events. It's important to note that Ticagrelor was approved for medical use in the European Union back in December 2010, and shortly after, in July 2011, it received approval in the United States. These approvals signify that regulatory agencies found it to be both safe and effective for patients. Understanding the approval timeline helps us appreciate how quickly this medication became available for clinical use after demonstrating its benefits. Overall, this slide sets the stage for discussing how Ticagrelor fits into the broader landscape of stroke and heart attack prevention, highlighting its significance as a therapeutic option. Let's take a closer look at how Ticagrelor works. Essentially, it blocks the adenosine diphosphate, or ADP, receptors on platelets, specifically the P2Y12 subtype. By doing this, it prevents the signal transduction that normally leads to platelet activation, which is a key step in clot formation. Now, what's interesting about Ticagrelor compared to other antiplatelet agents is that it binds to a different site on the receptor. This is called an allosteric site, meaning it doesn't compete directly with ADP. Because of this different binding site, the blockage it causes is reversible, giving it a unique advantage in terms of how it acts and how quickly it can be reversed if needed. This mechanism is crucial because it helps us understand how Ticagrelor effectively reduces the risk of clot formation while maintaining a certain flexibility in its action. Connecting this to the overall theme, understanding this mechanism helps us appreciate why Ticagrelor is a valuable option in preventing thrombotic events in patients. Let's take a closer look at the pharmacokinetics of this medication. First, when it comes to absorption, the bioavailability is around 36%, meaning that about a third of the dose actually reaches the systemic circulation. The time to reach peak plasma levels differs depending on how it's administered. If taken as tablets, it peaks in about 1.5 hours, but if the tablets are crushed and given through an NG tube, it peaks faster, around 1 hour. Moving on to metabolism, the drug is primarily processed by the enzyme CYP3A4, which converts it into its major active metabolite. There's also some metabolism by CYP3A5, but to a lesser extent. Understanding these enzymes is important, especially when considering potential drug interactions. As for elimination, the half-life of Ticagrelor is about 7 hours, while the active metabolite has a slightly longer half-life of around 9 hours. This helps us understand how long the drug stays active in the body. Finally, regarding excretion, most of the Ticagrelor is excreted through feces, about 58%, and around 26% through urine. The active metabolite is mainly excreted via the biliary system, with less than 1% eliminated through urine. Connecting all these points, Understanding the pharmacokinetics helps us determine dosing schedules, anticipate interactions, and manage patient care more effectively. Now, let's take a closer look at the uses of this medication. It is primarily indicated to reduce the risk of cardiovascular death, myocardial infarction, and stroke in patients who have experienced an acute coronary syndrome or have a history of myocardial infarction. This means that for patients at high risk of serious heart-related events, this medication can be a crucial part of their treatment plan. Additionally, it's used to lower the risk of stroke in patients who have had an acute ischemic stroke, particularly those with a NIH stroke scale score of 5 or less, which indicates a mild stroke. It's also indicated for patients with high-risk transient ischemic attack, or TIA, which is often called a mini-stroke, but can be a warning sign for future, more serious events. So overall, this medication plays a key role in secondary prevention, helping to prevent further, potentially life-threatening events in patients already at high risk due to their cardiovascular history or recent stroke. It's an important tool in our effort to improve patient outcomes and reduce the burden of these serious conditions. Now let's talk about dosing. After a patient experiences an ACS event, the initial step is giving a loading dose of 180 milligrams of Ticagrelor, taken orally, and this is a single dose. This rapid loading helps to quickly inhibit platelets and reduce the risk of subsequent events. Following that, for the first year after the ACS, the maintenance dose is 90 milligrams twice daily. It's important to note that the first 90 milligram dose should be taken between 6 and 12 hours after the loading dose to ensure proper platelet inhibition without increasing bleeding risk. After the first year, if the patient continues on Ticagrelor, the dose is reduced to 60 milligrams twice daily. This lower dose helps maintain the benefit while minimizing potential side effects over the longer term. Additionally, Ticagrelor should always be administered along with a daily aspirin dose, typically between 75 and 100 milligrams. An important point here is that using aspirin doses above 100 milligrams can actually decrease the effectiveness of Ticagrelor, so keeping within this range is crucial for optimal therapy. Overall, these dosing strategies are designed to maximize antiplatelet effects during the critical periods following an ACS event, while also balancing safety and long-term management. Let's talk about some of the adverse effects associated with this medication. For those effects that occur in more than 10% of patients, dyspnea and bleeding are the most common. Dyspnea, or shortness of breath, can be uncomfortable but is usually manageable. Bleeding, on the other hand, is a more serious concern and requires careful monitoring. Now, for side effects that happen in about 1 to 10% of patients, we see dizziness, nausea, diarrhea, and ventricular pauses. These are important to watch for, as they can impact your daily life or indicate more serious issues. Other side effects to be aware of include pain and swelling in your joints, which could be signs of gout. Mild rash and headache are also possible, but tend to be less severe. It's also crucial to note that, although rare, Ticagrelor can cause a serious allergic reaction. So if you experience symptoms like swelling, difficulty breathing, or hives, seek medical attention immediately. Overall, while these adverse effects are something to keep in mind, it's important to weigh them against the benefits of the medication in preventing serious cardiovascular events. Always discuss any concerns with your healthcare provider to ensure safety and effective management. Now let's talk about contraindications, which are critical to understand for safe medication use. First, hypersensitivity is a key point. If a patient has a known allergy or reaction to this medication, they should not receive it. Next, a history of intracranial hemorrhage, or ICH, is a serious concern because this medication could increase the risk of bleeding in the brain. Active pathologic bleeding, such as peptic ulcers or an ongoing ICH, is another contraindication because administering the medication could worsen the bleeding or cause further complications. Lastly, patients with severe hepatic impairment should avoid this medication, as their liver's ability to process the drug is compromised, which could lead to adverse effects. Overall, these contraindications help us identify who should not receive the medication to prevent serious complications and ensure patient safety. Remember, always assess the patient's history carefully before prescribing. Let's talk about some important interactions with ticagrelor. First, ticagrelor is a substrate of CYP3A4, which means it is metabolized by this enzyme, and it also acts as a weak inhibitor of CYP3A4. This is significant because drugs like simvastatin or lovastatin, which are also metabolized through CYP3A4, can have increased serum concentrations when taken with ticagrelor. This increase can raise the risk of side effects, so it's recommended to avoid simvastatin and lovastatin doses greater than 40 milligrams when used together with ticagrelor. Moving on, ticagrelor also inhibits the P-glycoprotein transporter, which is important for drugs like digoxin. If a patient is on digoxin, you'll want to monitor their digoxin levels carefully whenever you start or change the dose of ticagrelor to avoid toxicity. Now, regarding opioids, since they are often used in acute coronary syndrome, it's important to note that co-administration of opioid agonists can delay and reduce the absorption of ticagrelor and its active metabolite. This is probably due to slowed gastric emptying caused by opioids. So, in cases where patients require opioids like morphine, it might be better to consider a parenteral antiplatelet agent instead to ensure effective platelet inhibition. Overall, understanding these interactions helps us optimize therapy and avoid complications, ensuring our patients receive safe and effective treatment. Let's talk about some important interactions to keep in mind when using ticagrelor. First, strong CYP3A4 inhibitors, such as ketoconazole, can significantly impact how ticagrelor is processed in the body. Because of this, co-administration should be avoided. These inhibitors can substantially increase the exposure to ticagrelor, which in turn raises the risk of adverse effects like shortness of breath or bleeding. On the flip side, we have strong CYP3A4 inducers. These also should be avoided because they can greatly reduce the amount of ticagrelor in the system, which means the medication might not work as effectively. So, avoiding these interactions is crucial for maintaining the drug's efficacy and safety. Now, regarding aspirin, if you're using doses higher than 100 milligrams per day for maintenance, it can actually decrease how well ticagrelor works. That's why, after the initial loading dose, it's recommended to use aspirin at a lower dose, specifically between 75 and 100 milligrams daily. This helps ensure that ticagrelor maintains its intended effectiveness. Connecting all these points, the key message is that careful management of drug interactions, especially with CYP3A4 inhibitors or inducers, and aspirin dosing is essential for optimizing ticagrelor therapy and minimizing risks. Thank you, keep learning. It's been great sharing this journey with you and exploring these ideas together. Remember, learning doesn't stop here. It's a continuous process. Every new thing you discover adds to your growth and expertise. So stay curious, ask questions, and seek out opportunities to expand your knowledge. This commitment to learning is what drives progress and innovation. And as we've seen today, applying what you learn can truly make a difference. Thank you again for your attention and engagement. Keep that momentum going. This slide doesn't contain enough information. That's why we're moving to the next slide. This slide doesn't contain enough information. That's why we're moving to the next slide. This slide doesn't contain enough information. That's why we're moving to the next slide. This slide doesn't contain enough information. That's why we're moving to the next slide. This slide doesn't contain enough information. That's why we're moving to the next slide. This slide doesn't contain enough information. That's why we're moving to the next slide. This slide doesn't contain enough information. That's why we're moving to the next slide. This slide doesn't contain enough information. That's why we're moving to the next slide. This slide doesn't contain enough information. That's why we're moving to the next slide.